What's up guys, Lee Skinner with AI Physio here at Iron Ground Gym. This video is dedicated to people who have low back pain when they're squatting. We're going to cover two of the most common categories that I see associated with low back pain during a squat. One of those is poor muscle control, and we're going to be really focusing our time to the pelvis and trunk, or people call it the core, but we're going to get really specific with what muscles we're targeting and how to control them. And the other one is mobility, and we're going to focus to the spine, hips, and the ankles. And we're going to talk about how each one of these things contributes to your squat and contributes to pain during your squat. So for trunk muscle control, what I want you to focus on isn't just the upper part of your back, because I think everybody's sort of figured out at this stage that you don't want to round your back during a squat. That's pretty common knowledge. But what I see happening now is that because we taught everybody don't round your back during your squat, now we have everybody that doing this overarching whenever they squat. Their chest is way up here and their butt is way back and they're arching their entire spine excessively during a load. And they do that because when you arch your back, it feels secure. You feel that contraction in your spine, things feel tight here, and that makes you think you're stable. And oftentimes what people are doing is they're going overkill. They're arching further than they need to, and they're not controlling their pelvis during the motion. So the first thing I want you to think about is when you take this squat position, rather than arching your back as hard as you can, getting under the bar and starting your squat in a completely uncomfortable position, the first thing I want you to do is I want you to flatten out your back a little bit. Now, I'm not telling you to round your back. I'm not saying to step up to the bar and to round your back and tuck your butt under you, but I do want you to start gaining some control, okay? So go from this overarched position, and that's what you find yourself doing. Put your hand on your back and flatten it out a little bit. This should feel a lot more comfortable whenever you step up to the bar. If you step up to the bar and the first thing that happens is back pain because you're getting into a position that's uncomfortable, then you're missing the boat. That's not the position that we want to put your spine in whenever we load it, okay? So, overarch, flatten the back a little bit, and the way I'm doing that is I'm using my pelvis, right? So I'm tucking my butt under me, I'm arching, under, arch. I want you to find that middle ground here where it feels comfortable, but you also feel that contraction in your spine muscles here. They're telling you you're stable. And it should be a comfortable position. It should not hurt right off the bat. Another reason why this really matters is that if you take this huge overarch position and you start to come down into your squat, you'll hit the bottom and you will round out of that at the very bottom. Now everybody calls this butt wink. And this is one of the most common reasons I see is that everybody starts in this overarched position, and when you get to the bottom, you will experience some posterior tilting of your pelvis, which is this. It will happen. I see a lot of people saying that this should never happen during a squat and it should be perfectly stable throughout the entire range. That's not going to happen. You will see some degree of posterior tilting at the bottom. The key is to minimize it. Because if you start off in this huge anterior tilt position, which is what you're doing when you overarch, then you will have a huge motion into posterior tilt at the bottom. And that increase in motion, okay, from a large anterior tilt to a large posterior tilt is where I see pain contributing the most. Not necessarily from a small posterior tilt, which everybody should experience at the very bottom of a squat if you're going beyond parallel. So if you're going to film yourself from the side here, what you'll notice is if you take your overarch position from the top to the bottom, you're going to see a large degree of tilt in that pelvis at the very bottom position. If you reduce the anterior tilt at the top, and you get stable here, and you come all the way down, you'll notice that butt wink isn't going to be quite as exaggerated, and that's what our goal is less anterior to posterior translation during the end phase of the squat, and a more comfortable stance at the top when you get under the bar. Okay, so we just talked about excessive positions and excessive motion when you're under the bar and the lack of control associated with that. Now, when we talk about this control, let's start talking muscles, because what I was just teaching you was a neutral spine position, okay, which is not overarching, it's not over rounding, it's kind of that middle ground that feels comfortable and that you can maintain a load and that you can stabilize in that position. But when we talk about stabilization, let's go over some muscles. So we're talking abdominals, we're talking obliques, and we're talking gluteal muscles. And all of these contribute to pelvis and trunk stability. So everybody that's doing a heavy lift knows that you have to do this Valsalva maneuver. Well, I say have to. Many people do this Valsalva maneuver. And what they're doing is they're creating a rigid compartment. They close their glottis here. They're cutting off their air, okay? and they're creating a really rigid compartment throughout the trunk. Now, that's really common, but I want you, when you think about rigid compartment, you're thinking stability. But I want you to think the same thing when it comes to your pelvis here. Because, again, this overarched position, this excessive movement that occurs under the bar, that's not a stable pelvis, okay? So instead of hinging at the end of your available range, thinking that's control and that's stability, I want you to start focusing, other than just the abdominal contraction that you experience during that Valsalva, I want you to think about using your gluteal muscles and your hips to start stabilizing the pelvis along with you, okay? So what we're gonna do is when you take this neutral spine position and you start doing your squat, what I want you to think about is, I want you to think about pushing your feet slightly apart, and then almost like you're rotating your feet apart like this. If you were on a sliding board and your feet were standing, you'd be able to rotate them out like this and push them away. Now they're not gonna move on the ground, okay? But I want that's the contraction I want you to do. And I want you to feel yourself squeezing your butt when you do that, okay? And you should be able to focus the contraction to the glutes whenever you're doing this position with your legs. When you do that, I want you to practice holding that position along with your abdominal contraction. Now, when you practice this, you don't have to do a Valsalva, okay? Meaning you don't have to hold your breath and grunt. Just practice hardening the abdominals. The focus here is that during the squat, you don't want to see your pelvis rotate here, here, or side to side, or any rotation at all. You want to see a stable pelvis during the squat. And some people have difficulty controlling this at the very end range, the very bottom phase of the squat. So I usually have people start off at the beginning phase, mid-range, and they work their way down. But what you should feel is that as you're squatting down here, this is stable. Abdominals are contracted, and I can do this contraction while I'm talking and breathing. You should be able to do that. You shouldn't have to hold your breath to contract the abs. And I'm squeezing my glutes at the same time. And I'm gonna come down and up slowly and just practice this position with my squat. And you should notice very little movement is occurring at the pelvis, and that's the key to a stable pelvis during a squat. Now, I'm not saying your pelvis will not move during a squat. Please don't misunderstand me and start videotaping yourself, and every time you see movement, you think you're doing it wrong. You will have some movement, but the idea is, other than just doing the Valsalva and thinking that that's the only thing that you need for stability, I want you to think about using your butt along with your abdominals to control this maneuver better, so that when you put a huge load on your back and you get down to that bottom phase where you have the most difficulty, you can practice this throughout the range to gain better muscle control. The glutes need to work with the abdominals in order for this to be a truly stable position for you at the pelvis and spine, okay? That's the key. So we're talking about all this muscle control, so let's talk about why this matters for low back pain. Now, I don't need you to go out and search the internet to find a diagnosis for your low back pain, to say, well, I was told I had a herniated disc, or I was told that my disc was degenerative, or that I had I've had facet arthropathy. I don't need you to find a diagnosis in order to go through these motions and figure out why this matters for your back. And the reason is you don't have a good load tolerance for your spine. Okay, now what that means is that whenever you're going into these in-range positions and you don't have good muscle control, your spine is giving you this pain signal that's telling you, I don't like this move. And when I teach people this neutral spine position, and I teach them how to stabilize there, all of a sudden they go from, okay, this is uncomfortable, they do their contraction, they say, okay, that feels a lot better. And they can even go from a pain with a squat with just a bar to a full range squat bar with some weight on it with very little to no pain. And it's basically improving what's called a load tolerance. Now that is not dismissing a diagnosis for back pain. That's not what I'm doing. But what I want you to know is that there's very little correlation between a specific diagnosis and a specific thing that you have to do with weightlifting. So don't focus your time to, well, a herniated disc means this. You're going to waste your time there, and you're going to find that a lot of times what we see on our x-rays and our MRIs, how that correlates with your performance in the gym, there's very little correlation there, oftentimes. So don't go around searching the internet trying to find the right diagnosis based on your symptoms. You shouldn't be focusing on self-diagnosis anyway. What I want you to focus to is, okay, let me do what I know I can for my spine when I'm working out, that I know is healthy, I know is productive for my spine, which is we're working on controlling the spine muscles, building muscle control, and working on stabilization during your lifts. So this neutral spine position works on abdominal control, works on the low back here, because every time you tilt that pelvis, you should be activating the muscles in the back and in the abdominals, and you get those to work together to improve your spine's load tolerance. And then we work from there and we start adding load. Another reason this is helpful is that a lot of people who have poor gluteal control during their movements, and they have this buttock pain, and this is kind of low back or out to the side or both sides on their buttock area, they find that using these gluteal contractions along with the low back and abdominal contractions that we are practicing with this neutral pelvis position, they find that's automatically more comfortable too during their lift. And all these muscles have to work together to produce stability during your lifts and help you improve your spine and your spine's load tolerance. Now we have to talk about mobility, and we're going to focus on the hips and the ankles for this. And we're going to go over why this matters with the squat. Now if you're standing, and I've already created a video on how to check your hip mobility and ankle mobility, and it's in the PhysioBody screen, so click the link to find that. You'll be able to screen yourself to see if you do have any mobility issues, and it'll teach you how to work on those too. But let's talk about hip flexion first. So hip flexion is this right here. Now if you're standing tall and you bring that hip up and you can't get past 90 degrees, meaning it's not parallel to the ground or higher, you're stuck here, well here's what's going to happen, you'll notice. If you try to come further, what you're going to do is you're going to round your back to try to get there. Okay, to try to make that knee come up higher because you don't have good hip mobility, you're going to round your back forward. The reason that matters is because if you're under load and you get down to that position and you don't have adequate hip flexion, you're going to do the same thing. You're going to start rounding your back, your butt's going to tuck under you to try to make that motion happen, and now we've got a lot of load on your back, and now it's getting a little bit more sketchy, okay? So the problem is with hip flexion, if you're dropping down and you don't have the range of motion, you will round your back to get there, to make that motion happen, okay? Or you'll tuck your butt under you, which is essentially the same thing. It's lumbar flexion whenever your butt comes under you and your pelvis tilts this way, okay? Now hip rotation also matters, and specifically hip external rotation. So that's this right here, okay? Now, again, check the video if you don't know if you have adequate hip rotation, but if you want to see it during a squat, if you come down, you'll notice the big difference here between knees completely straight forward in front of the trunk, and what happens right here, we start getting these tissues to touch together. In order to keep coming down lower, I have to round my back to get there. If I open my knees up from that position, okay, so if I start here, I come down, and I get stuck here, if I open the knees up, I create that motion. I create that space, so where I don't have to round my back to get to the lowest phase of my squat. Now this motion from here to here, that's hip rotation, okay? Just like this, your femur bone is doing this right now. And that's outward rotation, so you have to work on that too, and work on it with the squat as well as without. And I've got a couple exercise videos that show you how to work on hip mobility. So that's hip rotation, that's hip flexion. Now, we can't ignore the ankle here, okay? Because if you don't have adequate what's called dorsiflexion, which is the shin bone here, this tibia, can go forward on that ankle, okay? Far enough. Forward on the ankle just like this without your heel coming up. Then what's going to happen is during the in phase of the squat at the bottom here, if you don't have adequate glide of this bone forward on the ankle, then what you're going to do is you're going to have to stick your butt back to try to make up for it. Because you can't bring that tibia bone forward enough in this position. Now if you want to do a little test squat down here, and if you find yourself falling back, that's exactly what you're going through, is we don't have enough mobility here at the ankle, okay? So the compensation pattern I see is people will take their feet, they'll rotate them out, and they'll start collapsing in at the ankle, and they do that because they don't have adequate motion to go straight forward. So what they do is they turn their ankle outward, and now they're coming forward, but with turnout, so they don't have to have as much range of motion going forward. That pattern is going to get you in trouble. So when you're working on ankle mobility, my suggestion would be check out the dorsiflexion or the lunge to wall test. You can click on the link to get there. Do the lunge to wall test. See if you have adequate ankle motion with your foot on the ground. Don't just test it up here in the air, okay? Test it on the ground. If you don't have adequate ankle motion, then that could be a big reason why you're seeing that you have to shift back here to get down to the ground. And that can cause an increase in back pain, because basically what you're doing is you're shifting from a position of stability, you're having to lose that and come back to make up for the lack of ankle motion. And that's excess strain, stress and strain on the spine during the motion,
rather than stability during motion, which is what we want. Okay, this last one is really important. This is hip stability, okay? Now I see this go unchecked in the most elite lifters that come into my clinic. And the reason is the motion you guys go through, squat and deadlift, both feet are on the ground, and the weight shift that you are probably experiencing is going to be minor whenever you look at it on a film, or you can usually tell a little bit better with film, but if you're just watching it with the naked eye, it's hard to catch this. Because both feet are on the ground, you can have 30–40% weight shift and it may not be seen, even with a video sometimes. So I want to teach you guys how to go through a test in order to see, okay, do I have hip stability? Is it symmetric on both sides? This is a huge deal. If I could just get everybody to do single leg training, and by the way, I'm not talking about a single leg press, that's not what I'm talking about. I'm talking about single leg squat and single leg deadlift. Not even a pistol squat. All the CrossFitters that are doing the pistol squats, and they come into my clinic, they have this big beefy thigh, and they're basically bouncing off of that thigh from the bottom phase up. They're bouncing off their ankle, and they're bouncing off the hamstring hitting the calf, and they think they have great hip control because they can bounce out of that pistol squat, but I slow them down and make them stop 3/4 of the way through, and they hit the ground. They do not have good hip control. Same thing happens with some of the best powerlifters I've been able to meet. I get them on one leg and they fall apart. And this can't happen. If you're putting, I guess it depends on your weight class, but if you're putting serious load on your spine, you have got to have good hip stability. And if you don't, it's just a matter of time before you start to pay the price for it, okay? So this pain pattern is usually, could be back pain here, it could come out to the side and be in the buttock. Another common one I see, and I've seen this one more lately, I don't know if things come in trends or in patterns in my clinic, I don't know why, is groin pain. Now there's quite a few reasons why you can have groin pain. These videos, again, these are not videos to diagnose you. Do not search for an online diagnosis on YouTube, please. Don't do that. What I'm talking about is when we have pain in a certain area and we can correlate that pain with a movement disruption on that side. Maybe we have groin pain here, and when we do a good contraction, stabilize the hip, it feels better. Then we have some good information about how to tolerate your lifts better, how to train better, but I'm not going to try to diagnose you with a certain thing in your hip. So please don't search for that. That gets people in a lot of trouble, okay? Hip stability. So how does it contribute to groin pain? So if you don't have good hip stability from the gluteal complex, gluteus maximus, gluteus medius, gluteus minimus, okay, that's 3 gluteal muscles. They're not controlling you well during your descent and ascent during your squat, you're going to get in trouble, and here's why. Everybody has a small degree of what we'll call knee valgus during a squat, specifically when they bounce out from the bottom, okay? A small degree of that is not a terrible thing. It's not going to make you fall apart. I don't know where this came from. There's a lot of injuries correlated with valgus, which is this here, and I'm not saying this is how you should be squatting. Not even close to saying that, but what I am saying is that under load, every coach that's been around for a while, every strength and conditioning specialist knows there is a small degree of valgus people will go through, and you don't have to blow the whistle at them just because they do that, okay? The reason that happens, there's 2 reasons. One, as you squat further and further down, okay, your glutes lose the moment arm or lose the same force producing capability. They start to lose that the deeper you go down, okay? They are less optimal to create a large force production in the lower phases of the squat. And one of the things that happens is the adductors, okay, specifically the adductor magnus, which is a big beefy muscle on your groin here, the inner thigh. That muscle and your hamstrings actually have a really good moment arm, or we're talking about torque here, but basically let's just say that those muscles are in a certain position to produce a really good contraction to allow you to extend the hip. So, from the bottom, let's go over that again. I used a lot of bad language there. So, as you squat down, the further you go down, the glutes lose their ability to produce a really good strong contraction, a really good force-producing contraction. They lose their ability the deeper you go. And as you come back up, and you need to extend the hips, right? This is hip extension. Well, if I'm weight on the ground, this is hip extension. Basically just means my femur's coming up. The adductor magnus and the hamstrings have a really good force-producing capability in that phase. So what they're going to do is they're going to get you back up off the ground. The problem is, adductor magnus does this to the knees The hamstrings that are on the inner portion here also can do this to the knees when they're extending the hip. So when you're down here at the very bottom and you're coming up, if you see a small degree of knee in, don't be surprised, but we have to minimize that as much as we can with gluteal control. Now I said the glutes lose their force-producing capability the deeper you go down. That's true. That doesn't mean they're gone. That doesn't mean you can't still work on gluteal strength in those phases. And if you have a lack of glute strength, it's going to really show up at the bottom there, because abductor magnus is very strong, has a really good line of pull to get you back up off the ground, but it will pull your knees in, and you have to fight that with your glutes, okay? Can you have a small amount? Yes, you will. Anybody doing a 1 rep max in a competition, you're going to see it pop up. Very rarely do I see somebody not have any collapse of those knees at all. So, work on gluteal control. This is hip stability, okay? So, gluteus maximus, gluteus medius, gluteus minimus, the whole complex. Don't just train one, and for goodness sakes, we're going to go over exercises, but don't get on all fours and kick your leg up in the air. That's just not going to cut it. I know the EMG studies show a high level of activation of the glute. I'm sorry, that's just not good enough. We have to put the glute under some serious load in order to get it strong and to have it control that. And the foot has to be on the ground. We can't do this kick back thing in the air and expect it to carry over to a squat. It's ridiculous. So, hip stability, we're going to work on all 3 glute muscles. I'm going to go over some exercises, and that's why it matters for your squat, okay? And we talked about this earlier, we talked about trunk control and trunk stabilization. The glutes have to work together with the abdominals in order to create a nice stable surface so that your limbs can move around and your trunk has very little movement during the squat, which is what you want when you're doing heavy loads. So that was a pretty long tirade there. Hope you guys made it through that. So let's go over the test on how to train this, okay? So single leg. I want you to do a single leg squat. Find a bench, okay, or the height of a bench, and I want you to squat down to the height of that bench and come right back up. I want your leg out in front of you. I want your hands up in the air, and this is going to help you see whether you stay level or not if you start dropping and twisting everywhere. And what I want you to notice, and there's a video for this, click on the link to go through the squat test in more detail, the single leg squat test. But what I want you to notice is, okay, is it the same side to side? So rep it out. See how many you can do on one side, how many you can do on the other side. Is the number the same, or at least within 90%? I shoot for 95% symmetry on the rep, but also, is the control the same? Does it feel the same? When you watch a video of it, which I'd encourage you to videotape your single leg squat, does it look the same? Do you stand on one side and this one's awesome and you go up and down and it's really stable, and then you get on this leg and all of a sudden it's all this wobbling everywhere? All this control that I'm doing right now, this is all coming from the hip. And if you can't do it well on one leg compared to the other, then when you put a large load on your spine, you better believe you are shifting weight and not producing maximal force production throughout both sides. Now, unless you're injured, you don't care about all this stuff. I'm assuming that you have some back pain or hip pain, and that's why you're watching the video. But even if you're not, these are good training tools, because this is going to help with maximal force production and maximal power production. We know that any excess motion during a movement is going to make you a little bit less mechanically efficient during that movement. So we all talk about bar path, right? Well, if I'm looking at bar path and I have one leg doing this and the other one's stable, the bar path will change as a result of that. And if we change bar path and it's not straight up and down or pretty darn close, we know we've just lost mechanical efficiency during the lift, and we know that we've just lost power or force production. So that matters to people who care about how much they can weight lift, but believe me, these two are tied together. Any movement disruption is very often correlated with a loss of force production capability. I've had people come in that lift through pain, and that's what a lot of you guys do. You do have some pain whenever you lift. You lift through it, and your weights get stuck. You start doing single leg control, and within weeks, I see the numbers start to climb up on squat and deadlift. Now that's a single leg squat test. Another one that's really good is a single leg deadlift test, okay? Why? Because we want to be specific with our lifts. If you're squatting and deadlifting, you should be testing all the things associated with a squat and a deadlift, and not just everything in the air, okay? So, Single leg deadlift, grab a bar and basically perform the closest version of your deadlift that you can with the bar on one leg. And start with the bar, by the way. And the test is probably going to be done with just the bar. Do not load up 2 plates, 3 plates, and do a single leg deadlift, or you're going to be coming in to see me. So hold the leg stable, and rather than squatting with the knees coming far forward, your bar will be here, and you're going to do a single leg deadlift maneuver. And you're going to try to keep the bar level, okay? There's another video here you can click on if you want to see that in action. Single leg squat, single leg deadlift, check the hip stability. It matters for your spine and your hips. So we went over stability and mobility and how these things relate to a squat. But if you guys want any training tools, feel free to check out these videos here. They go over how to work on hip mobility, how to work on hip stability, how to analyze these things with the PhysioBody screen. Check all this information out. Let me know what you guys think. If you do like it, please like the video. Give me any comments you guys have, any feedback. I'm always looking for feedback. And let me know how I can help. Thanks, guys.